Some kids are returning to school with new social distancing guidelines in place, and others are starting off the semester remotely. But parents of students in both situations are concerned about the mental and emotional toll that the pandemic may be having on their children. In a May Gallup poll, 29% of parents surveyed said that social distancing and closures have been harmful to their child's well-being. Meg Oliver reports from Little Falls, New Jersey.
Did you ever feel like you were depressed?
A few times.
11-year-old Rocco Testa will be a sixth grader in Little Falls, New Jersey this fall. Over the last few months, like many kids, the pandemic took a toll on his mental health.
It was just me being angry at the world and everything because of COVID and stuff.
Rocco has ADHD and some learning difficulties, which made virtual school challenging. As his grades slipped, he began lashing out.
Virtual learning has been a huge blow to him, to his academics and his mental health. And not having the support and the teachers there to help him has been just detrimental.
Rocco, who has type 1 diabetes, is now dealing with depression and anxiety. The Testa family is not alone. At the end of the school year, nearly 3 in 10 parents reported their child's mental health was suffering due to social distancing and closures.
We're seeing increases in anxiety. There have been increases in calls to suicide and mental health hotlines.
Kathleen Minke is the executive director of the National Association of School Psychologists. She said it's not just the pandemic currently affecting kids' mental health.
There are problems with racism and violence, and so you really have a piling up of stressors for many, many kids.
Why is it so important to train about children's mental health before you go back?
If the student is not in a good place socially, emotionally, they're not going to be able to learn.
Nikki Wong Xing is a guidance counselor in the school district of Philadelphia.
How bad did it get for some of your students in terms of their mental health issues last spring?
What I saw happen a lot is this feeling of isolation, some stress too. There were family members that lost their job. And then some of the kids with things that were happening with the Black Lives Matter movement and George Floyd. And that's really hard because we weren't there to kind of help them through that process.
The district launched a program called Healing Together. It focuses on 4 areas: social emotional learning, mental health and trauma, relationships and community, and adult wellness. The program provides resources, workshops, and support for students, staff, and families. Back in New Jersey, Rocco is starting to feel better. He's playing football again, and he regularly meets with his school psychologist.
What's your advice for other kids that might be feeling the same way?
When you feel angry, just take a second and walk away.
I know that we're not unique, and people need to know that this didn't just affect our economy and all these other things. It affected our kids.
And their minds.
And their minds, and their mental health.
Meg Oliver, CBS News, Little Falls, New Jersey.
To dive deeper into this topic, Dr. Daniel Bober joins me now. He's a child psychiatrist certified in child and adolescent psychology. Welcome, Dr. Bober. It is great to have you with me. I've been speaking with many parents who say that this return to school has revealed just how much stress their children are facing as a result of the pandemic and protests for social justice. This period before might have felt like one extended summer vacation, but now heading back to normal when things are very clearly not normal, it's revealed that children are really suffering. So please tell us, what can adults do to help children navigate their emotions?
Well, we're obviously in the middle of a pandemic, but there's also an epidemic of toxic stress that we're dealing with right now. And it's particularly affecting the most vulnerable members of society, the poorest people who are working in cramped spaces, maybe a single parent who doesn't have any help. So kids are definitely suffering right now in a way that they haven't before. And I think what the school districts need to do is really focus as much or more on the social and emotional health of these kids as much as the reading and the writing skills.
Well, what are some of the warning signs that something might be wrong with a child, and at what point should parents seek out professional help?
Well, kids tend to not be as good at verbalizing that they're dealing with stress, so a lot of times it will manifest physically. For example, they'll have temper tantrums. They might say they have a stomach ache or a headache. You might see sleep changes, weight changes. these are all signs that there might be something deeper going on.
And that other question about seeking professional help, at what point should parents actually seek out additional resources?
I think if they're at the point where it's affecting their daily functioning, their ability to learn, their ability to negotiate the relationships in the family and their peer relationships, then they probably need to seek professional help at that point.
And Dr. Bober, what about young children versus older kids and teens? Are certain age groups more at risk?
Well, younger kids are different in the sense that they're going to need a lot more one-on-one attention and guidance, so that puts a lot more stress in the family. And remember, when there's stress in the family system, kids model that behavior. So if you as a parent are not handling things well and coping well, that's going to, pour back onto the child, and they're going to experience that and model that as well. So it's very important, I think, before we start getting into an online learning situation, to really have a family meeting, to have a schedule, and realize, most importantly, that things are not always going to go smoothly, that you're not going to be able to replicate an 8-hour day, and to realize that it's not homeschooling. You're trying to get your kids to learn at home, but don't expect to be perfect, and mistakes will happen.
All really valuable advice. I'm wondering what other specific things you can offer up to parents who, as you heard from Meg Oliver's piece, at least a third of parents say that their child is dealing with stress and anxiety as a result of what's going on in society right now. I think that those are some good suggestions about schools. Any others that you can share with us?
Yes, absolutely. I think it's important to create a designated workplace that's free of distraction. It's important to take frequent breaks. Kids have a limited attention span, and so, if they're going to learn for 45 minutes, they can take a 15-minute break. And I can't say enough good things about exercise. Exercise is great for dealing with stress, depression, anxiety, insomnia, and we know that kids who exercise also probably learn better too. So exercise is an important, healthy coping skill, giving your kids positive feedback. And I tell this to parents all the time. When you cannot stand to be around your child, when you are at the end of your rope, that is when your kids need you the most. So the behavior is a communication. When the kids are acting out, they are communicating with you that they need you. They need that compassion, that empathy, and that acceptance.
I'm wondering if history is any guide. Have we learned things from past pandemics, other global traumas, about how they impacted children in the long term, and anything else that we've been able to glean from these types of societal disasters or other traumas like that?
Yes, actually, there is a very good example with this after Hurricane Katrina. After Hurricane Katrina, we saw kids who had increased depression, anxiety, post-traumatic stress disorder. And of course, a lot of them fell behind in reading and writing, but were eventually able to catch up. So there is a precedent for this. And for example, in the 1918 flu pandemic, there also was an uptick in mental health symptoms in both children and adults. So history is a guide, and we've seen this before. But what we have now that we didn't have before is digital technology and social media. So we can use that to try to stay connected and get the word out.
One last question for you. What kind of impact is the pandemic actually having on the mental and emotional health of parents, and any suggestions that you have on that front?
Well, again, I said it before, kids model their parents' behavior. So if you're a parent who is teaching from home, for example, you have 2 or 3 full-time jobs, not just 1 full-time job. So it's important, if you can, to get off the grid, to get someone to help out, to make time for yourself, to exercise, mindfulness, wellness, all these sorts of things, to make sure that you're taking care of yourself. Because if you can't take care of yourself, you're not going to be able to take care of your children either.
Yeah, I think so many people are trying to will themselves through all of this. It's important to recognize that there is an emotional strain that's happening for parents and their children as well. Dr. Daniel Bober, thank you.
Thanks, Lana.